I would like to emphasize a few key points before we get into the Pulse report to provide some updates. Cases have improved, but they have plateaued to some degree in terms, and we continue to monitor. In fact, the CDC director, Dr. Walensky, yesterday made a statement that emphasized the lack of desire to reopen significant parts of our communities and societies. And this was her exact quote yesterday. "Please hear me clearly. At this level of cases with variant spreading, we stand to completely lose the hard-earned ground we have gained. Now is not the time to relax." Now, we will continue to monitor those trends as we've talked before. I'm sure you're getting lots of email traffic. I'm getting lots of email traffic to talk about what we can reopen and how quickly we can do that. We continue to be optimistic based upon the numbers and how they're improving, but at the same time, we do have some concerns about developing a better, broader understanding of the impact of variant strains, which we know are more contagious and easier transmitted, to determine what their potential impact is on our communities and societies, to help determine what type of guidance we put forward, at least from a public health perspective. So for folks watching at home, we are continuing to monitor the numbers and continuing to monitor the trends, but we also are making sure that the guidance we put forward does not move too quickly so that all of the gains that we've seen over the last several weeks are not lost. When we look at our numbers, which I'll show you briefly, on the Pulse report, you'll see that we still have, even though it's improved, the number still fits into the high risk of transmission range per CDC, and it's actually at a higher level than where we were when we saw the beginning of our second peak earlier in late summer and early fall. I would also like to highlight, and I was on for part of the presentation, the first part of this morning session, and Kate Liu from CCACC talked about the work that they did this weekend in standing up a clinical opportunity. We use this as a pilot to test being able to support community agencies to stand up vaccine opportunities, and they were able to provide vaccinations in partnership with HHS of nearly 300 individuals within their community. And we know that, again, with email traffic, you're getting requests to stand up clinics and groups are interested. We're getting a lot of those requests as well. And we're continuing to explore building that infrastructure and creating frameworks for those opportunities to happen. Right now, clearly the rate limiting step is, particularly if the county apparatus is expected to support those, is the vaccine dose capacity. And we're hopeful that as that capacity increases and we get more doses, that we would be able to potentially identify other candidates to be able to create similar opportunities to provide vaccine opportunities for individuals who have had challenges and obstacles to getting vaccines, whether it's due through access to the registration portal or access to other information and transportation that would make it difficult for them to access. So I will pause there and go to the Pulse report. And just run through this really quickly because I would like to make some comments about the Johnson & Johnson vaccine that was announced over the weekend and approved. And I anticipate that you probably have a few questions about that. So let's go through here. Again, this is just numbers to show how we have progressed in terms of providing vaccines to our residents. As of yesterday, we vaccinated over nearly 14.5% of our population, which is higher than the statewide average of 13.5. And we are again increasing the number of second shots that we have provided to our residents. As it currently stands, we are providing those. The county apparatus is providing doses to 1A and 1B Tier 1 groups, and that's groups over the age of 75. And we have made every effort as best as we can over the latter part of last week and through the weekend to send registration links for clinic appointments to everyone who's over the age of 75 who's pre-registered in our system. We're working hard to get those folks in as quickly as we can so that we can anticipate moving to the next prioritization groups, at least from the county apparatus, because to remind folks, Any other venue throughout the county is vaccinating and providing vaccination to 1A, 1B, and 1C groups. Our hope is that we would move next to include the remainder of 1B, as well as individuals who are over the age of 65. This shows you how many doses have been administered by county, including first and second. On the left is the number of doses, the raw number of doses administered, and the right is the percentage of population that has been covered within that. And this shows you how it breaks down in terms of the number of doses that have been provided versus the number of doses that are allocated. And this includes those doses for this upcoming week's allocation for first doses and second doses. And this shows you the percentage administered by each of the counties that they have received. And again, this number fluctuates because if you had taken it yesterday, we would have been well over 98, 99%, but this includes this upcoming week allotment of doses that stretches that out a little bit more. This shows you the pre-registrations over time. Again, we do see significant gaps in terms of by race and ethnicity matching up with county population. There has been some improvement in this. And I want to take up this advantage and to say this, I know everyone is working to look at opportunities to stand up clinics and vaccine opportunities and partnerships. We support building that infrastructure, but we really need folks' help right now is getting people pre-registered. That's where we need folks engaged right now, whether it's getting them pre-registered and through phone systems or all those different things, and reaching out to community folks to help them get there. So to all of our community partners, we certainly support efforts to look at exploring how we can partner delivering the vaccine, but we really do need your assistance right now in leveraging your community networks and partnerships to get people pre-registered, because when they're pre-registered, we have their information and we can send them links when we move to those particular groups. And for folks watching at home, Councilmember Jawando's point to the millions watching at home, we need you to also pre-register in the system, particularly if you are over the age of 65, as well as if you're part of those essential employee groups designated in groups 1B, Tier 2, and Tier 3. Because, again, can't say definitively when that's going to happen, but in the near future, we hope to be able to move to providing vaccine opportunities to your groups, and we need to have your information. And so when that green light goes on, that we're able to provide those links to you because we have your information in the system. This just shows statistics by different occupation. This shows that you can see pre-registrations are increasing in our younger age groups, the 18 to 64 group, a little bit down, 65 to 64. And again, we need that number to go up because you're going to be a part of the next category that we provide vaccines to. Encouraging, though, we're seeing a little bit of an uptick in registration in our communities of color. And this shows you a breakdown of how that pre-registration maps out in terms of our census tracts. We still have significant ways to go in terms of some of these communities that have redder districts, if you will, because that also lines up with, unfortunately, communities that have been hit harder with COVID-19 so far. And because of that information, here are the zip codes that have been prioritized as Tier 1 zip codes based upon the number of cases and the number of fatalities so far experiencing the pandemic, and particularly over the last 90 days. And this is a schematic to show how the breakdown is for overall vaccines administered through the county by race and ethnicity. Again, you can see we have some improvement and room to grow, certainly. And this breaks it down by the 75 and up population in terms of the percent vaccinated versus the percent of county population. Less gaps, but still some disparities there in terms of the particular outcomes. And just to remind folks, the reason why we have focused on age is because you see the relative risk of having a COVID-related fatality if you contract COVID is significantly higher as your age increases. And so we see it from, when you move from 60 to 69, the relative risk is 3 times higher. And when you move from 70 to 79 to over 80, the relative risk is 4 times higher of having a COVID fatality. All right, so the last thing I'd like to highlight and spend some time talking about, and I know I'm taking up a lot of time today, but I think these are important issues to address to level set expectations for our residents. And I'm anticipating some of the questions that you all may have. Yesterday, over the weekend, the third vaccine candidate produced by Johnson & Johnson did receive FDA approval, and the Committee for Immunization Practices met over the weekend to discuss safety parameters related to the vaccine. They concluded their meeting on yesterday, and as it stands, did not provide a significant number of guidelines, if you will, in terms of how those doses should be prioritized or used. We have not received any formal guidelines from the state as well in terms of how those doses will be prioritized. So we are continuing to look at all of the relevant research data, the clinical data from their research trials to figure out how to best leverage those doses. I know we've already received a number of input and questions and asks about how those doses will be used. I would like to ask you, and I'm anticipating that may be some of your questions. We're working on that right now. We've actually been working on that overnight and into the morning to determine how we will allocate and use the doses that we will receive. We found out yesterday about 12:30 that we would be receiving an allotment of doses of the Johnson & Johnson doses. We have not received those yet. We anticipate we could get those today or tomorrow, and we will be introducing those into our circulation to be used this week. We don't have definitive dates yet, and we haven't definitively nailed down who those will be used with. So please stay tuned and exercise your patience. So if that's a question on your list, hold off. We're working on it, and we will be moving to address that. But I did want to take advantage of this opportunity to dispel a couple of myths about this vaccine, because there have been some concerns raised in the community that it could be seen as an inferior vaccine compared to Pfizer and Moderna. And to just kind of get some information out there so our residents understand how this vaccine can be used. And yes, it is a safe, viable option for individuals within our society to use, particularly within our jurisdiction. So we are working to train staff on the administration of the vaccine and building out clinical schedules. We're continuing to review the guidelines that we've received so far, as well as work with our regional partners and those other health officers across the state to make sure that we are using it in a uniform way. And I just want to hear a few important points. The Johnson & Johnson vaccine has been tested in a number of diverse places, including places where variant strains have had higher numbers. For example, a significant portion of their clinical research trial was conducted in South Africa, where we know that one of the variant strains that is on the rise was present. The global efficacy of the Johnson & Johnson vaccine was 66% against moderate to severe illness, 85% effective against severe disease, and 100% effective at preventing death, as well as hospitalizations. 100%. No one who got the vaccine died from COVID-19. So just want to emphasize that 100% effective at preventing death and hospitalizations. It was tested again in different populations at different times, more recently than the first two candidates. And I bring that up because there has been concern about those other vaccines being able to cover the variant strains. So far, the information has shown that they are effective against those. But the Johnson & Johnson dose was tested more recently, where we know that there may have been more exposure of individuals to those variant strains within those trials. And that included over 44,000 individuals in the United States, South Africa, and Latin America. And again, more recently with the potential presence of those variant strains. Now, there has been some concerns. Some of the data suggested that the efficacy was lower in individuals over the age of 60, that it dropped from 66% to 42%. In participants who were over the age of 60 with underlying medical conditions and comorbidities. Yet, there are concerns about that, in terms of the strength of that information. And again, ACIP did not, as best as I can recall, has yet to put out any guidance in terms of contraindications based upon age or any type of condition. There was concern about the strength of that data because there were fewer participants and a lower incidence of COVID-19 cases in that particular age group. And a greater proportion of those who participants were unblinded in the study because they became eligible for other authorized vaccines during the trial. So the takeaway is that the lower efficacy rating that you may hear about could just actually reflect some imprecision associated with a smaller number of cases. It does not mean that the vaccine isn't safe for seniors with comorbidities, but it does mean that we, along with everyone else, will continue to monitor and watch for more data about the safety and effectiveness within that population group. And again, await further guidelines from groups such as ACIP in terms of how we move forward. The other point that may be a little bit, there's two other things that may be a little bit different about the Johnson & Johnson vaccine versus Pfizer and Moderna. Protection against moderate to severe disease starts about 2 weeks. It gets maximized 2 weeks after people get vaccinated. This is a little bit different from our Pfizer and Moderna vaccines, where to get that maximum peak of 95% protection, that is achieved 2 weeks after the second dose of the vaccine. By 4 weeks after the shot, the data from the clinical trials show that there were no hospitalizations or deaths associated with COVID for those individuals who were vaccinated. Now, the Johnson & Johnson vaccine also uses a slightly different technology from Moderna and Pfizer. The Johnson & Johnson vaccine uses viral vector technology. And what that means is a common cold virus, adenovirus, is genetically engineered so that it can infect cells to provide the information to produce the immune response, but it does not spread to the body, it does not replicate there, and you will not develop a secondary illness or a cold because that was introduced into your body. It simply presents a copy of the virus in simplistic terms, presents a copy of the virus into your cells to mount an immune response so that your body can build memory in terms of providing the necessary defense against the virus if you encounter it in the future. So I will stop there, but wanted to just take the opportunity to dispel those myths so that if individuals are presented the opportunity to receive that vaccine, they do not see it as I'm getting a lesser opportunity to get the vaccine, and that there is an opportunity to receive adequate, fair protection against COVID, as well as protection against some of the severe secondary consequences that unvaccinated individuals may encounter. There's still lots of questions to be asked, but we anticipate, again, we're continuing to work to get that information out and hope to be able to provide more information to the general public about those vaccine opportunities associated with this new vaccine in the very, very near future. So please stay tuned. I will stop there. Sorry, I took up a fair amount of time, but I thought it was important to get that information out to our general public. I'll turn the floor over to either Dr. Kroll or Dr. Stoddard, but happy to answer any questions. Thank you.
Thank you.
Dr. Kroll, do you want to speak next, or I can start?
Sure, I'll go ahead and jump in because I think it's relevant. It ties into questions that I've seen in the package this morning, and I think that it also ties, as we think about vaccination, into equity issues that I know folks have raised. So I'm going to try, if I have capacity, to share a quick screen, and I'll do this very quickly for you all, and then we can just go go on from there and any questions that you might have. So I wanted to just give you all an update on the equity plan and where we are in terms of its rollout and the impact that it is having in the county. To begin with, just a reminder that we Equity is started our frame with two things. One is tracking how and where the virus has hit us, looking at zip codes and looking at census tracts within zip codes, and then looking at case rates and death rates by race and ethnicity within those zip codes. And then using that information as to guide our distribution efforts to make sure that we were allocating higher percentages of vaccine to high impact zip codes and allocating based on race and ethnicity. And then using a pre-registration system to ensure that we were not doing first come, first serve, to make sure that the state, that folks had an alternative to chasing vaccine through the state system and especially for our older population. When we set this out, these were the initial priority top 1 zip codes that we set in place and decided based on the data that we were targeting allocation of doses. And I think the other thing that as we went through this process, we realized that we needed to expand out to include our second tiers, other areas that have been highly impacted as well, so that we will continue to hit high impact areas and target doses to specific communities that were impacted by this. So this is a before and after shot of where we were vaccinating where vaccinations were being received, 75-year-old and up population for the county. And this is after we implemented the framework for equity in the county. And what you see is a notable shift in how vaccines were distributed. We didn't stop distributing where we were, we just focused our emphasis in those targeted high impact areas. And just for reference, you all have seen this before. But I'll show you this again. This is the right side compared to where we track COVID cases over the last 3 months. And so you'll see the east of 270 and going north and south, where we have begun to target doses and showing some impact in terms of people who are being vaccinated in relation to where the impact has been greatest. So there's some sense that we're getting doses to where they need to be, and that the framework is having the effect. Overall, this is where we are in percentage of folks that are vaccinated by census tracts in the county. And you'll see some areas are farther along than others, but there's some good progression around getting 75-year-olds and older vaccinated in the county. And I think when we look at our registrations by race and ethnicity over time, what we see when we went to full notifications of folks who were invited, asked to come, and that we send invitations out or links out to be scheduled for vaccination. When we went to full implementation, we saw an immediate bump in terms of the folks that were sent out once we implemented the frame. And then we saw a gradual tapering down of that. And that is the 75 plus effect of us running through all of the people by race and ethnicity who had pre-registered for vaccinations, and then expanding out our group, the expansion out beyond to the second tiers as we exhausted that list. You see the numbers start to go back up for a moment. It also coincides with our move to East County a weekend ago to do some weekend vaccinations. So you see the numbers jump again, and then they start to decline again. It points to some challenges that we have with this, I think. That we pre-register, and getting folks to pre-register is a challenge. And if we don't have folks pre-registering, we're not holding vaccine, we're distributing vaccine because we want to get vaccines out to everybody. But it does point to a need to do a harder push around pre-registration and getting folks in. So for updates on this, I think we will be updating our 90-day case rate and looking to see where the virus is moving to make sure we are still on top of that piece of the puzzle. And I've said it before, this is a reason for people to continue to get to be tested regularly for the vaccine, for the virus, just to make sure we know where it is showing up in the county. And we'll continue to look at that by zip code and by census tract and by race and ethnicity to make sure we are using that data appropriately in our distribution effort. The pre-registration will continue in the way we have, trying to get folks in so we're not doing first come, first serve, and so that we give people options around distribution. The state, I'm told, is moving to some pre-registration system. I don't know that we have full details around that at this point. But to this last point, I think Dr. Gales has made this point, the expanding pre-registration efforts in the community is vital, and people have we've got to get the community engaged in this process. We're working with OCP and the community partners and the regional service center directors to try to launch that. We made a personal outreach to the faith-based community last week to get them to do more around pre-registration. There's a pre-registration effort coming up this week with Mount Calvary down in Silver Spring to try to do mass pre-registration of folks to get them pre-registered, and so that we can quickly get them scheduled. We're still working on 75 and older, but we're also looking at, we also have a number of folks who are 65 and older that will be moving to in the near future. So we want to make sure they get pre-registered as well, so that we can continue to implement a plan that ensures equitable distribution. And the last thing is we are working to close what we're calling the last mile gaps around pre-registration. And that is the large scale vaccinations that we're talking about, making some of those regional, like East County, and continuing to do that and as we move around the county and identify hotspots, but also doing population focused vaccination. CCACC, I think, is a good example of that. We are working with a couple of our partners to do home-based vaccination so that we can take it to folks who cannot get out. That's a slow effort, and it is still dose dependent, obviously, but as we get more doses and we get more people vaccinated, we're working to make sure that folks who can't get to us, we can get to. And then the last one is transportation for those who need it, to make sure that is not an impediment to getting folks to a site. There are some folks who identify that as a pre-registered. It's important for them to do that. We have a team in the department and across the county that is working on scheduling and helping folks to find rides where they really need them. But we're also talking to the community about their capacity to help get folks to registration sites by transportation as needed. And there are some churches who have indicated their willingness to do that and to help us to do that. So that is the quick update on this. I think, how do I stop share on this? In terms of the slide deck that I wanted to share with you. And just to say that there is, as we move to, we will not stop vaccinating in 75 and older, obviously. We will continue to do that, and we'll continue to do outreach to the community to get folks vaccinated. What we really need more than anything, as Dr. Gales has said, I think earlier, is that we need to get folks into the system so that we can manage this in a way that is equitable. Without that, we are left vaccinating first come, first serve, whosoever will in this system. And we really do need to make sure we continue to target this. So we're going to need all of your help to message that for folks and to help us to do that piece of this work. I think Dr. Gills did talk about us expanding our efforts and talking with partners around their capacity to vaccinate and to offer vaccines in niche places. We'll be working with our minority health initiatives around those issues, but that's putting that in place so that as doses become available, we can ramp up those efforts. We still have to do all the other things that are necessary to get folks pre-registered and get them into a system and to make sure that they are ready for that. So the educational opportunities are going to continue, efforts are going to continue, along with ramping up opportunities in local areas for folks to pre-register and become a part of this system and get ready for it. So I will stop there and turn it over to Dr. Stoddard, I guess.
Thank you. I'll limit myself to 5 minutes since we're already about 40 minutes in. Now, obviously, we'll get to questions. Couple additional updates. We continue to work with the state and try to press them to include a mass vaccination site in Montgomery County. At the direction of Mr. Ricci from the governor's office, I've been working with one of my counterparts from the Maryland Emergency Management Agency to try and get some lessons learned from the other statewide mass vaccination sites so that we could prepare a proposal to the state. I also did a walkthrough up at Montgomery College Germantown campus to look at that as a possible mass vaccination site. I know the public health team is actually going out there again today to look at that site, because I think one of the things that we discussed doing is, potentially utilizing that site as a county site to illustrate to the state that it's a fully functional opportunity to do a mass site at that same location by showing throughput and flow and all those things in real time. And so we're trying to do some different things to illustrate to the state. Obviously, with the increase that we've seen in doses this week, that's a positive thing. And so, in my conversation with the state, they believe that there is a capacity limit even to the six mass vaccination sites. And so as the state continues to see more doses, they believe that there will be more opportunities to do vaccination sites, whether they're fully called state mass vaccination sites or not. For example, I know the governor is a big fan of the site up at Timonium in Baltimore County. So, if we have something like that in Montgomery County, that it becomes a very easy opportunity for the state to lift its numbers up overall with. So we can continue to work on those efforts to try and get those things taken care of. I think actually I'll go ahead and stop there, and I'm sure some of the other things I was going to update on will come out through questions.
Okay, thank you all. This is, you're doing terrific work. We really appreciate the update. I was going to ask Dr. Stoddard for the update on the mass vaccination site. So thanks for your work on that. That's very helpful as well. I have a long list of colleagues that want to ask you a question. Let me just begin by asking you though, the state was supposed to have an update to the PrepMod system last Friday that would disallow residents from would customize the appointment link so they can't be shared. And then on Friday, I think you told us that the correction was being delayed for the 5th time. Has there been an update to that system since then?
Yes, so we actually got a report this morning that it should be working as of late yesterday afternoon.
So I talked to Sean from Public Health, and he said that they're going to begin to integrate it for use, particularly with second doses, because they just want to make sure that it's stable and working the way it's supposed to before we assume it's working fully, as this is the 5th attempt to get it working. So we're doing a trust but verify setup with the new system, and so those links, they're going to be utilizing that new system today and then expand its use as we gain confidence.
And I tested the system yesterday, and it seemed to be working fine. So we'll, roll it out slowly to make sure we're not having problems with it, and then we can ramp it up.
More good news. Hopefully the 5th time is the charm. And finally, let me just ask, since Quince Orchard and Richard Montgomery have been 2 of our county operated vaccine locations, and the schools have been reopening at limited capacity, what's the plan for those sites? And is there renewed discussion with large businesses like the Fillmore and Silver Spring and others that have offered their facilities?
So we have been looking at other sites from the very beginning, particularly to scale up. So the reference to the site in Baltimore County, we've been looking to expand, again, given more capacity. We have taken a different approach in terms of having a central location to be able to spread it out and make sure it's geographically accessible across the county, to alleviate any difficulties that transportation might provide, as well as ensuring that those venues are in or proximate to those high volume zip codes that we know have been hit hardest. So I say all that to say that we have been looking at a number of other venues to be able to provide that support as we transition out in those spaces, as others come into the spaces, for example, schools, but then also opportunities to scale up and offer larger venues for our residents.
Terrific. Thank you. Okay, let me turn to colleagues. And I think we're going to stick to the 5-minute rule. Councilmember Glass.
Thank you very much, Mr. President. Doctors, thank you very much for the update. And Dr. Gales, I too want to start by thanking you for representing us so well on 60 Minutes and for sharing with our community and the entire nation why we need more equitable distributions here in Maryland. So thank you. And as I've said before, I have confidence that President Biden and his administration will be able to improve the supply chain and increase the doses that are manufactured so that Governor Hogan will be able to provide us with all the doses that we need, being the state's largest and most diverse jurisdiction. And on that topic of equitable distribution, over the weekend, I received a number of emails and phone calls from municipal leaders, residents, and senior care organizations who expressed some concern and confusion about a vaccination event that occurred late last week and was organized by Giant's Pharmacy. And as it has been shared with me, Giant vaccinated nearly 200 individuals, which is fantastic. But in organizing the event, Giant took doses from one of its hardest hit stores, the store that serves one of the hardest hit communities, one of our tier 1 zip code areas, and diverted those doses to another part that is not in the tier 1 area. And so Dr. Gales or Dr. Stoddard or anyone, Dr. Kroll, do any of you know anything about this? And I guess more broadly speaking, what is the relationship that we have between these pharmacies and the deployment of these precious doses that they have?
So Travis, you want to go? You want me to?
I can start and frame it from the state perspective and set you up to talk about the equity piece, because I do think it's important for folks at home to understand who oversees these and how these processes happen. Because I think at the heart, everyone sees vaccine and assumes it's just one big operation. The county oversees this and comes with questions. So what happens is the doses that are provided to the pharmacies are provided directly from the state to those entities. The local health departments and the county, the government entities don't have any say in terms of how those doses are allocated, when they're allocated, how many are allocated, and how those doses are used once they get to that space. We have asked repeatedly that from the state perspective, that in those efforts, working with those pharmacy partners and others, that there be a requirement and expectation of some type of equity framework within that. We do applaud the fact that, the pharmacies are making attempts to form community partnerships to increase access to the vaccine. That's something that I think we can continue to explore and would like to be included in those conversations. Again, we've not been included in those conversations to date. And I know that in thinking to our last session, Councilmember Albornoz mentioned you all sending a letter to the pharmacy leadership so that we can create some opportunities to discuss those partnerships. So again, for the folks at home, the way the retail pharmacies create those opportunities on their own, we didn't have any input into that and insight into that, and so we were notified about that event happening after it transpired. But it certainly does underscore the concern that we have promoted around equity in terms of how those doses are allocated and used, because certainly we do. While we appreciate the spirit in terms of increasing access to it, we want to make sure that it's not just a system of first come, first serve, or there's partnerships that are formed that don't take into consideration those equitable framework ideas. Dr. Kroll.
So my addition to that is that to your point, we did not know about this process and had no direct involvement in it, and was not aware of that doses had been pulled from one community to one of the hotspots to another, from one giant and a hotspot to another. This looks to my eye like a very successful effort at advocacy on the part of a particular group or community to work with Giant to pull doses into the community. Unfortunately, it had the undesirable effect of affecting equity, of not being done in an equitable fashion and not addressing that. I am a fan of anything that helps us to get doses into our community, especially to our senior community, but it has to be done within an equity framework. And either the state needs to, we hope that the state would help the drugstores, would help them to get permission to do that on a regular basis, and that they would work with us to make sure that they are doing that within the hotspots. So that bringing those doses closer to folks in the hotspots would be a great alternative, because it would add more doses to the effort and align their efforts with what we're trying to do around an equitable distribution.
Well, I appreciate that, and also clearly appreciate the collaborative spirit. We want every single person vaccinated, but we also want it to be equitable. And we have had that conversation day in and day out from this dais over the last number of months, and we'll most certainly speak with the chair of the HHS committee and all of you to see if we can implore all of the private pharmacies and others who are providing doses to work with us to adopt our framework as the policymakers to make sure that we do this in an equitable fashion.
I would only add, Councilmember, that number one, the pharmacies also get to decide which stores get the vaccine and which don't. And so obviously it's a big, not just who they're giving them to, but which communities they're serving. But I would also add the one unique thing that was in this week's vaccine bulletin. The state sends out a weekly vaccine bulletin that gives some guidance on where doses are going. There was a clear change in the pharmacy allocations to say that they're going to have roughly 50% of the doses going to the pharmacies be available through their stores, but 50% of their doses would be for clinics for vulnerable populations. Now, vulnerable being a definition that was not defined in the document per se, but I think it speaks to the fact that the state is looking to shift its strategy a little bit in an effort to try and address some of these equity considerations. I heard the same thing from some of our colleagues at the state. They're trying to shift to address equity in a more specific way, but it's going to be because there's not a coordinate statewide effort to do this in a really uniform fashion. You're going to have these inconsistencies, unfortunately. So I do agree that we should try and pressure to the extent that we can that they be done and everyone's swimming in the same direction, kind of deal.
Thank you.
Great. Thank you. Councilmember Reamer.
Thank you very much. Wanted to just make a brief comment on the regulations issue. I continue to believe we're doing the right thing by holding tight generally. I think keeping at 25% capacity for restaurants, for example. I read this morning that Montana has even rescinded its mask order. There's a lot of craziness going on right now, but we're holding tight. The one exception to that, I think we really have to look at the childcare rules. I'm very concerned that our private providers will not endure, and they are a public-private partnership. And so I hope that there's some work going on now to shift us to the state model. And as we've discussed, it is needed. I understand that doing that will allow the hubs to continue to operate in the off weeks when the schools, because a lot of kids are on an A-B schedule, 1 week in the school, 1 week at home. And there's some work happening to find alternative locations, but without these ratios, the schools themselves can't provide those. Secondly, I wanted to just ask if you think we are prepared for the manufacturing surge that's coming. I've been doing some crunching of numbers to try to understand the commitments that have been made at the federal level and then how that could flow down to the county. And I think, determined that indeed our residents were correct in their clamoring for more access to the vaccinations in the early weeks of the rollout. We may well have not received, our residents may not have gotten their share of the statewide dose allocation. I'm still trying to understand those numbers. But when we look forward at what has been pledged from the manufacturers, from Pfizer, from Moderna, and from J&J, there is a huge surge that is coming in this month. And I understand that generally the federal government has said that they will distribute to the states according to population. And generally, I think, we would expect that the state would do the same. So under that framework, understanding there will be variances. There could be 450,000 doses coming that, according to our population share of the state's allocation, from the federal surge, which is 146 million doses that are coming in the next 4 to 5 weeks. Pfizer has said they're shipping 80 million doses this month. Moderna, an additional 46 million, I think. J&J, 20 million. So, I think it's going to really change the context of the pandemic. I think a month from now, hopefully there won't be the rate of hospital admission that we have had throughout the course of this pandemic, but we'll see. But B, please just share with us what you expect and how you're thinking about this. Thank you.
Well, thank you, Councilmember Reamer. So your first question, yes, the child care piece is being worked on, and that is something that's actively being worked on, and I anticipate that we'll be able to hopefully trying to figure out how to do that if we have to go through EO on all those logistical things. But I anticipate that is something that we will be able to address as you laid out due to those concerns. So stay tuned, everybody. The second component related to the capacity issue, I did receive an email from you this morning, and there was some communication from the state. So what you can share with your colleagues at the state who responded to your email is that we do have capacity, and we've not received an increase in doses from the state. We did receive, we're going to receive the allocation from Johnson & Johnson. And so we are able to distribute what the state has provided to us, and we welcome more doses from them. So if they're watching, that's our response to that. Now, when we increase what you referenced, the significant increase in the number of doses, I think it's important for folks at home to understand is that with that increase in doses that you referenced, that would also open up other opportunities for other providers to be able to provide vaccines. So when you're saying there are 400,000 doses that are coming to Montgomery County, those 400,000 doses wouldn't say, health department, get out 400,000 doses. That would increase, and this is meaningful because I think this is another point that folks have been asking for, is for private providers to be able to have access to the vaccine. And so that increase in doses would allow for doses to be shipped directly to primary care providers and other providers within the community, so that it increases the network of opportunities for folks to be able to access. It would also allow us to shift, if you will, the health department to be able to be more of a safety net provider for individuals who don't have access to those particular options. We've been working hard to, again, behind the scenes, create these partnerships and infrastructure to be able to stand up and support other entities to be able to administer the vaccines. I know that there's at least one proposal that has been sent to you all by at least one of the initiatives to talk about that. So those are the kinds of things that have been worked on behind the scenes to create that infrastructure that will create a multi-pronged network for all of our residents to be able to go through and access. So the short answer to your question is, in the short term, we do have capacity to administer the doses we receive. We'd like to get more. And on the longer term perspective, that increase in doses, which would be a welcome problem to have, if you will, would allow for many other doors to open up to be able to absorb that capacity.
Thank you. And do you think the state is preparing those other providers sufficiently for the possibility that they are going to be needed to administer?
Well, they did open up the registration system. I think there's over 700 providers across the state who signed up in Immunet. I think that was the number quoted last week. And so if we continue to get more providers signed up through Immunet to get officially registered and cleared to administer the vaccine and receive the vaccine, that would again open up a lot of opportunities. So I know the state did that about a month ago. And, those providers have just been waiting for the supply to get to a point where the state could be able to share that supply with them.
Thank you.
I would also just note that, and even what we've done at the county level, for example, we helped Holy Cross get the site up. I know many of the council members visited that site. That site's capable of doing 1,500 doses a day. They haven't done 1,500 doses in a week because they haven't had the vaccine available to them. The site that I visited up at Montgomery College, at Montgomery College, Germantown, and the public health team is following up there today. I would expect that site's capable of doing 3,000 to 6,000 doses a day just by the actual space, square footage, parking, all the physical amenities. Now, staffing will continue to be a challenge. We're going to continue to work on that. But I think in terms of the infrastructure, we're planning for an eventuality where we have a lot more vaccine, and we're not just comfortable sitting on the spaces and capability we have today.
Thanks.
Thank you. Council Vice President Albornoz.
Thank you. First, Dr. Gales, great job on 60 Minutes. And for somebody who is getting about as much sleep as they got during medical school, you were sharp. So terrific job. And it was great that our vaccine hunters got a shout out as well. Want to start with a comment this morning, and then I have two questions. We are all feeling the anger and frustration of our residents. The constituent calls that we're getting every day are real, they are raw, and they are certainly understandable. While I can fully attest to the fact that each one of us, especially our Health and Human Services team, is working around the clock and as hard as humanly possible, 24/7, and that's not hyperbole, to make sure that we roll out this vaccination process in a way that's equitable and gets to as many people as possible, as quickly as possible, especially the most vulnerable. Everyone's working as hard as they can. And while it's understandable that there is the frustration and anger and disorientation that's out there, it's also important to note that lines can't be crossed. Bigoted or racist comments made to any one of us or our staff, or abusive comments made to any one of us or our staff, and especially the folks who are on front lines, is totally and completely unacceptable. It's morally wrong, and frankly, it makes an already difficult situation somehow even worse. So I urge all of our residents, please continue to contact our offices with expressions of that frustration and anger, and we're going to do our best, as we have been all along, to channel that in a way that's productive and address our constituent needs. But lines cannot be crossed. So with that said, Mr. President, I do have two questions. One is specifically with, last thing, in addition to our staff and obviously all of us within the county that are working on this, it especially can't be directed at our county residents. There has been an alarming increase, especially in our Asian community, of derogatory comments that have been made since the beginning of this pandemic, starting with our president. But we are now starting to see evidence of that at the local level, and it is impacting the emotional and behavioral health of our residents. And so that also cannot be crossed either. And we stand with all of our county residents. And I know all of my colleagues have posted about this, have said this, and I know all of us feel the same way, that we have your back to our community, and we won't stand for that either. On a different note, to get to specific questions, with regards to defining independent living facilities, there understandably is a little bit of a gray area in that there are some facilities that may not technically be specifically designed to serve our older adult community or vulnerable populations, but may organically, by virtue of its affordability or where it's located, have a significantly higher percentage of individuals who are at risk. If you guys could comment on where we are with the definition of independent living facilities and some further guidance that we can propose. I know our colleagues in the Housing Opportunity Commission and others have also brought forward questions, and I know we've been working on this, but just wanted to check on the status.
So I can tell you just two things about it. One is that we've been working with the state and our Office of Aging and Disability, Service Area Aging and Disabilities, to identify those 61 or however many number there were of facilities that are designated as senior living communities, independent living communities. But we've also worked with DHCA and HOC to identify places where there's a preponderance, a higher number of seniors living in those facilities, in those communities, so that we're not just limiting our efforts to those designated independent living communities. So we're gathering that information and pulling it into Aging and Disability has been working with public health to identify those communities and to help us to reach out to prioritize them for vaccination as part of our effort.
Thank you, Dr. Kroll. That's super helpful. Just two final questions. First, kudos to you and your team and DHHS who have been working with the disability community as well as providers. And I also, once again, want to give a shout out to Dr. Greenberg and many of the other folks that are working so hard on this. As we've been stating all along, and obviously HHS knows this intimately, there's so many individuals within the disability community that don't live in group homes. So I just want to first thank you for working to address the systemic challenges that bears and work on a solution to those challenges. And if there's any way our office can continue to be helpful in that space, please let us know. But there still continues to be a lot of anxiety and anxiousness, particularly within the disability community, on when there will be sort of a system rollout of some sort, or even more enhanced communication than we're already providing, especially the great news that more vaccines are going to be made available. Just want to make sure as we discuss equity, clearly we need to focus on the hardest hit zip codes, but also these communities that have been disproportionately impacted as well. So keep up the great work there. And the final is one last comment to Dr. Gales's point earlier. Yes, absolutely. We're working on correspondence to the leadership of both our supermarkets and pharmacies that are important partners moving forward. We've already gotten some positive feedback from one of those pharmacies, and that will be leading to a meeting coming up, which we will make sure that you are there for and won't schedule if you can't be there, as you as well, Dr. Kroll and Dr. Stoddard. And more information will come. And I also want to give a shout out to our federal delegation, who has been very supportive of our efforts to reach out to our private sector as partners here. So thank you very much, Mr. President. I yield back to you.
Thank you so much. Councilmember Rice.
Well, thank you. I want to pick up where Councilmember Glass left off, because it was months ago that I, on one of these calls, highlighted the fact of the inequities that posed for our pharmacies and distribution. And so it's no surprise that we're seeing what's happening, and it will continue until there are strict regulations regarding the dissemination. Just a simple mention by the state of saying that, well, you should try and do things equitably and make sure that you're reaching out to vulnerable populations. Well, anyone, and we've heard this from every single constituent who has reached out to us, considers themselves a vulnerable population. So let's just be very clear, that's not going to adhere to the level of equity that we've talked about. So again, let's call out what we're seeing, which is our private provider pharmaceutical companies are out there doing whatever they want. It's the wild, wild west in terms of dissemination of vaccine. You've seen them pull from vulnerable neighborhoods and take it to more affluent neighborhoods, and that is shameful. I've said it before, I'll say it again. This whole distribution realm that the state has run has continued to be ineffective and continued to put people of color at risk, and it needs to stop. But, you know, it's up to the governor. And Governor Hogan, who I'm sure has aspirations to do a number of things, continues to make sure that when it comes to giving vaccine to public health entities throughout this state that have shown that they're committed to equitable distribution, has decided to take it away from them and give it to folks who don't have that commitment nor have a plan on how to make that happen. If they did, they would have partnered with our local minority health initiatives and others in the community to make sure that that was happening. But it's not. And so we continue to see what we see, which is, to Dr. Kroll's point, a continued reduction in folks, especially people of color and people of low socioeconomic status, registering for the vaccine because they don't think they're going to get it. And we can't continue to blame them for not signing up on a list, thinking and seeing that the fortunate people are always the ones who continue to get the vaccine, and those that are connected continue to get the vaccine, and those that are poor and those that are Black and brown are the ones that continue to be left by the wayside. That is what they're seeing. And so I cannot blame them for not wanting to register for a system that is working against them. And until we fix that, that is one of the stumbling blocks to us making sure that we have people of color, people of lower socioeconomic status registering. Why would you register for a system that seems to be stacked against you? So that's the question I have for Dr. Kroll, Dr. Gales, Dr. Stoddard. What do you say to people who see that everything is going against what they're trying to do, which is to ensure that people who look like them, people in their communities, can get the vaccine?
You know, I think I am maybe preaching to the choir a little bit around this, Councilmember Rice, but would say that a couple of things. That the system in terms of health outcomes is not stacked in favor of the people that we're trying to reach is nothing new. that folks have known this for years, and this has been the case. We've been talking about this for a year or more, and this throughout this pandemic and before then, especially related to health disparities and health outcomes and access to affordable care. I think that the challenge we face right now is that we have folks in the community who are who weary, who don't know where to go, who don't turn. We've got a confusing system that has been created throughout this process, not just by the state, but certainly the initial rolling out of vaccines was contributed. The confusion was contributed to by the federal as well as the state level around this, and there's still some continuing confusion around it. My message to folks is that, look, do not want Black and brown people to be the last people in this county who are not vaccinated and who are still getting ill and dying from this virus. Our commitment, the county's commitment, the people on this council, the people in HHS, the people who are working on this across the county, the commitment from the second floor and the county executive is to do this in an equitable way that gives them a chance to get into a system that guarantees that at some point they will have a dose of vaccine with their name on it that won't be stolen because somebody came along and pre-registered and on a first come, first served basis and pulled it out. We are fighting uphill. That is clear. I mean, the system has been uphill, so we're fighting uphill, and folks have to join us around that. I think there are a whole lot of issues. I don't think we have a lack of people who want to get registered. I think we've got a lot of confusion, and I think we've got to work doubly hard to try to get that message out to folks. And I think the last thing for me is that there's a need for our community partners, our community leaders to really help to double down those efforts and to get folks, not just the voices in this room, but the voices from the community to say, you know, this is your moment to change the historic trend in the outcomes around health equity and access to us.
Well, let me just close by saying this. I thank God for you guys, because if it weren't for the Montgomery County Department of Health and Human Services actually committing to doing this, we'd see many more deaths. We'd see many more cases in our communities of color. So thank goodness we have the Department of Health and Human Services, who is partnering with churches like mine, Mount Calvary, to make sure that we're doing pre-registration, and faith-based institutions throughout the county to make sure that we can pre-register folks. But guess what? Just as you said, we need to move the needle faster and harder than it is moving. And until we can get pressure, and I hope, Dr. Gales, that your presence on 60 Minutes elicits some of that pressure to the governor to do the right thing, to the state to do the right thing in terms of giving more vaccine to us so that we can equitably distribute it. And understand that there are people out there in our community who don't want that to happen. There are people out there who would prefer that it go to first come, first serve, because they then would benefit. That is real. So again, instead of getting to a place where we are, as one of my colleagues has penned, the Hunger Games, to where everyone's fighting against each other, let's hope that we can actually have some compassion, some understanding, some stepping out of the way so that an elderly person with co-occurring conditions can go before you and get the vaccine. Understanding that you may also have ailments. I get that too. But at the end of the day, we can all do the right thing. We can all wait our turn. We can all make sure that those who we know are more vulnerable can be taken care of first. That's what we're doing here in the county. And hopefully the state will at some point catch up and understand that that's what we need to do as a state as well. Thank you, Mr. President.
Council member, before you, Council President Hucker, just to say that thank you, Councilmember Rice, for the words of support, but want to make sure that the community and knows that without the support of the county executive and around the equity plan, without the council's full support around doing something in an equitable fashion, and the passing of racial equity and social justice laws that you all did more than a year ago now, this road would be a lot harder for us to plow in HHS. So it is collective effort and will that is making this possible in this moment.
Thank you, Dr. Kroll, for saying that. You know, none of you have mentioned yet the disclosure we heard from Acting Secretary Schrader yesterday that only since we're talking about the importance of equity, that only 3,558 of the 32,000 doses administered at Six Flags have actually gone to Prince George's residents, and over 10,000 have gone to Montgomery residents, 9,000 have gone to Howard and Anne Arundel residents. In East County, weekend before last, I heard our great former health secretary say, Dr. Benjamin say, one of the keys to effective public health policy is bringing the doses to the people, but we have a system in this administration that forces the people to drive all over the state to get to the doses. And of course, it's disproportionately, anxious and frustrated people, but those who have access to a car and a job that allows them, and a boss that allows them to take the time off work. Do I misunderstand this? Do any of you have anything to say about that disclosure, Dr. Gales?
Well, if you'll allow me a second of privilege to indulge in this, because that's what I was going to bring up. What's missing from the conversation is accountability and effective leadership. And I recognize in making this comment, I may put my job at risk because I'm a state employee, but quite frankly, enough is enough. We should not be afraid to speak out about the policies that are coming from Annapolis for fear that we may have, there may be ramifications. We may not get a mass vac site because we're critical of the governor. Some would argue that that may be what's happening now, quite frankly. But at the end of the day, it's about accountability and effective leadership and standing up and being able to acknowledge when there are problems in a system, and if things aren't working, you have to acknowledge and say, maybe we should change the approach that we're taking and do something differently. And from an equity standpoint, it is insulting to believe, well, it's not surprising that the acting secretary made that comment, because he also previously said that the response to equity was putting a site in Prince George's County and in Baltimore City. Yep. And what we're seeing is that lack of understanding of equity, which is a fundamental principle of public health, leads to situations that you've described where even though you put it geographically in that community, if you've not done the due diligence and the homework to remove the obstacles and the systemic factors that continue to drive those disparities, you will continue to see disparate outcomes. Similarly, there was a situation, I believe, in New York where they set up a large venue, I think at one of the baseball stadiums, or maybe it was in Harlem actually, with the intention of, well, we're putting it in a neighborhood that has a high percentage of folks of color who've been disproportionately hit by it. But when they opened it up, the majority of folks who came to the site were from hours away. And so if we continue to do cosmetic surface level efforts to address equity, why are we surprised that we continue to see these outcomes? At some point, we have to move past and learn from the lessons that we have seen time and time again, that surface level responses will not get it done. And we can't feign surprise and be upset and come up with a cosmetic photo op to address the issue without creating or investing the resources to fully move forward and address it. And I'm calling on the state to put the politics behind and really take a critical look and understand the impact of the decisions that they're making in terms of how these disparities continue to play out and how the efforts that have been put forward in terms of distribution strategies or support strategies continue to perpetuate these particular disparities. And it is not acceptable to acknowledge the disparities and then shift the blame to local health departments or other entities. It's time to step up to the plate and put in solutions that will really actually make a difference in the lives of our residents, because without that, we'll continue to see exactly what you mentioned, which is horrible to think that you put a site in a county that's been hit hardest by it, the most number of cases, and then expect people to say, drive 2 hours or drive an hour to come access that. I don't think that is an equitable framework. I don't think it's a fair framework. And hopefully, there'll be some critical self-reflection to think about how to move forward and move past this. So, sorry. Thank you.
Well,
it's tough to follow. Oh, sorry. It's tough to follow, but I did want to add one point. I think that one of the big things the state is doing is conflating hesitancy with equity. And hesitancy is a real issue, and equity is a key factor, but they're not the same thing. And if you treat them as the same thing, it shows a fundamental misunderstanding of the issues. And so I support the state addressing issues around vaccine hesitancy, but you can't use that as a surrogate for actually providing equal access and fair and equitable access to systems, not just sites. And so the whole process has to be equitable. If it's fatally flawed in how you seek appointments, as Dr. Gale said, there's no amount of locational placement that's going to overcome a structural failure in your access system. And I think that's what we're fundamentally seeing. You know, we can show in our results, as Dr. Kroll has done, that we actually have been able to get more equitable distribution of vaccine through our process. And we would encourage the state, maybe the state should be coming to us and asking us some questions about how we're doing it effectively, instead of just having these, hypotheses about how they can do it more effectively, because we can actually show our work.
Well said, both of you. And Dr. Gales, the comments you referenced by the acting secretary definitely betray a lack of understanding of how inequity works. And I think many of us, and certainly many of our senators all around the state, would like to see Governor Hogan put forward a nominee who shows more of an understanding of inequity in the public health system and the importance of focusing on equity. Council Member Novato.
Thank you so much. I am so grateful to this conversation, and I'm very grateful to you, Dr. Gales, because you are speaking truth to power. This is not a moment for anyone to try to be, coy about the situation we are facing. What you just described in terms of the state level, and what Dr. Stoddard just said, this thing about conflating equity with hesitancy, we've heard this time and time again, and it just sets up a self-fulfilling prophecy, right? Where you then say, oh no, it's because there are all these like deep-seated, fears and hesitancy, and therefore, oh, see, we told you that's what's happening. And I have to say, for me personally, I've always had this interesting dilemma in my years of public service, which have been this bizarre disconnect in terms of who we are in Montgomery County. We're still perceived as a totally, it's like we're like some other hologram of a county that doesn't look anything like what actually, who we actually are. And for some reason, it gets perpetuated at the state level. I mean, we are the most diverse county. We're the largest one. We understand that these issues are deep-seated, and we have responded to it. We've done that without guidance or support from the state. We have put in structures without any manual. And yes, we were very fortunate that all of us worked so hard on racial equity and social justice in 2019. I don't know if there was like a little angel whispering in my ear, because I had no idea we were going to be facing this. But yes, we're fortunate that we did that work. Nonetheless, it gets tiring. And I will say it again, for leaders of color, this is so exhausting. It's exhausting because we are seeing our family members, right? People that look like us, and we're trying so hard to kind of keep everybody going and pumped up and saying, stay the course and do this and do this and do this. And we're trying so hard to somehow communicate this notion of hope while there's this total disconnect that continues to occur. It doesn't make sense. And the data is just there, and it continues to just, slap us in the face. And here we are still begging for, a mass vaccination side or more vaccines to be, allocated. And wow, I mean, it is very exhausting. And I very much appreciate, everybody's work on this. This kind of leadership is so important during this time. I mean, we have to lead from the heart during something like this. This is a moment where these political games are just absolutely dangerous, and for folks who have just not figured that out, it's so heartbreaking. So I very much appreciate, the efforts, the targeting. I want to make sure that we continue to refine that work. And I heard you loud and clear that it's about pre-registration. And in that vein, want to make sure that we are allocating some of our resources in the communication outreach engagement space, for example, to TV and radio, to drive home that message, especially in our Black and Latino community, to be relentless on making sure that we are using media, our nonprofit, partners, community-based organizations, our own initiatives for everybody to then drive in that message and be very clear on how do you do that, right? So how do you pre-register? Here's the link, here's the number. If you can't do it, this is how you do it, etc. We will be shifting to that as well in my office to make sure that that is the message that we're sending loud and clear. And asking, and it's something that I do when they ask me to come and present to different community groups, etc., to also ask neighbors, if you have a neighbor that's Latino or is Black, elderly, please share this information as well. Let's do this work, let's do it together, because it's going to take everyone reaching out and doing all of this. I had two specific questions, and it's something that came up through a presentation that I gave this weekend. And I said that I would ask, and then we will send the information. Folks wanted to know about what are we doing, in corrections with folks who are detained. They also wanted clarification on how does pre-existing condition, like how do you communicate that when you are pre-registering, what qualifies and things like that. And so I'd like to ask if you could address that. And lastly, the translation issue with PretMod, if we have figured out if that's been corrected, because I keep getting also messages asking me if I know if that's been corrected.
I can start with the first one about the correctional facility. So we did have a meeting on Friday. DOCR Director Talley was on the call, and they are one of the groups in our 1B Tier 2 is our detainees and others in our correctional system. And so we will be including them over the coming weeks as we expand into that 1B Tier 2 and as well as their 1C Tier 1. So they will be included, as will our homeless population, and we added several categories that are not reflected necessarily in the state priorities. And we believe from a moral and ethical standpoint, they should be absolutely included in the vaccine effort. They are at disproportional risk in those congregate living settings, and largely many of them have underlying health conditions that predispose them, so that when they're living in those congregate living spaces, they are at higher risk. And so they will be included in our next tier of vaccination. That doesn't mean necessarily, I think we've said this for all the tiers, just because we move into a tier doesn't mean they'll be vaccinated tomorrow or even this week or next week, but they are absolutely in our next tier and will be covered over the coming weeks.
Thank you. And in terms of pre-existing conditions, how can folks?
So the pre-existing conditions that's a tricky one, because we obviously don't want to violate someone's personal privacy in terms of disclosing that information. And so interestingly, we discussed this weekend. The DC is moving forward into that category, and so we are watching how they're doing it and hoping to learn some best practices, because we're not quite as moved as fast ahead as they have. So it gives us the opportunity to figure out how to create a system where we may have some type of documentation to confirm a person's illness or condition. The hope and the reality is that by the time we get to that group, at least from the county apparatus, there may be a significantly higher number of vaccines available. And so that we may be able to, get a larger, to Councilmember Reamer's point earlier, may be able to get a larger number of folks through without having to, be as restrictive, if you will, in terms of the number of appointments there. So we'll continue to watch DC and other places to figure out some strategies that respect privacy, but also create a space that, it continues to be fair and for everybody using it.
Thank you. And any updates on the translation issue for PretMod at all? Do we
I
know?
don't have in front of me, but I can circle back and get back with you. I can touch base with our team to see if there are any updates and come back and respond after.
Thank
Sure,
you. Thank you
Councilmember
very
Navarro,
much.
just
Yes.
to add, we met with the team this morning. So the team, Dr. Gales and I raised a question this morning about the language inconsistencies that you referenced at least 3 weeks ago when you presented it to the Deputy Secretary of Health. And so the team is looking at that now. We also need to bring in our language proficiency team to make sure it's readable and it's understandable. So we're working on that now. The system is still being tested and it has been released, but we can't definitively say if those updates based on our initial assessment last evening, if those changes have been made. So as Dr. Gale said, we'll circle back with the team this morning just to make sure that all bases have been covered based on our input and feedback to state.
Thank you so much. Thank you.
Terrific. Thank you all. Councilmember Jawando.
Thank you, Mr. President. Thank you, as always, to everything that you all are doing. I was going to ask about restaurants, but I'll do so in writing afterwards just to know if we've had any increase in contact tracing. I can follow up after. I'm glad the numbers have seemingly plateaued, but I appreciate the urgency of continuing down the course so that we can get where we need to get as far as schools and childcare and so many other things. I did want to spend most of my time on this equity issue because I think I've spoken to some of my colleagues. I've spoken to you, Dr. Gales. You know, I pressed the Lieutenant Governor and General Burkhead over the weekend at the Kingdom Fellowship event where they took 100 doses with a partnership with Holy Cross and vaccinated mostly African-American community in a very high impacted zip code. And while that's great, I said, Lieutenant Governor, you need to declare racism a public health emergency. You need to give us a mass vaccination site. You need to have an equity plan that reflects those two prior things. And we can't wait. And I said the same thing to General Burkhead. And I'm told that there will be some sort of equity plan coming out this week in writing from the administration. I hope so. It's very late. But I just wanted to let you know, I think that we just continue to keep the pressure on. The other thing I wanted to bring up, I do think we are on the cutting edge, and what we have done, as you have demonstrated through data, is helping to have better numbers and reach communities that are hit harder. I brought this up before, but I think we need to go a step further. I think we need to explicitly open up by race at younger ages. I just think it's the only way we're going to get the numbers up. If you want to send a message to our Black and Latino community about the need to pre-register, open it up to people who are younger by 5 or 10 years. Black residents are dying 10 years sooner due to this virus. We have higher rates of death. And if you focus just on age, you're going to get what we get. And we're doing slightly better because we have the zip code overlay. But I think we've got to go further. You're going to get white residents getting the vaccination sooner and dying at lower rates. And that's what's happening across the country. And I just, as we move, so we're at 75 and plus now, I think we should be at 65 for the Black community. Most Black residents don't live to 75. The Latino communities are right in the middle. I think they should be at least at 70 when we're at 75. And you guys can figure out how to cut it. The legality on this is not 100% clear, but we're dying and we're not getting vaccinated. And so I'd love someone to challenge it. We've already declared racism a public health crisis here in this county. We need to do this, and this doesn't get better. 45 to 54-year-old Black people die much higher rate than 65 to 75 white residents from COVID. So we have to continue this down. And I think this would be a step we can take, not without risk, but we know there's a ton of risk and death and cases and everything we're seeing. And I think there is a case to be made for this. I know I've spoken to you about it, Dr. Gales and others. And I would just like to have you all comment on that. I think we have to take this step. It's another way to attack both the hesitancy issue, but also to push the state to have a real equity plan. And last thing I'll say, and I want you to respond to this. You know, when Dallas County tried to do what we've done in Texas and move to a zip code analysis, their state, in a racist act, said, we're going to reduce your doses unless you get rid of that plan. I think at a much more, kind of hidden way, we're getting that treatment by Governor Hogan and his team. We are doing things, and he's saying no mass vaccination site. He's saying we're not going to give you more doses, and we don't have an equity plan. So I think we need to continue to push. So that's my message to them. But my message to us is this something we're considering? Will we consider it? And I obviously strongly think we should.
So, Councilmember Jawando, thank you for comments. I think, and I'm aware of the situation that happened in Texas, and aware of some pushback that we have gotten in the county around this plan to do something that factors in or even talks about race and ethnicity in this process. But I think that the data justifies it, and that looking at where the impact justifies it as well. So my response is I don't know, and it's worth us talking with our legal eagles around this to understand what is legal and what's the boundaries of the law, and to understand how far we can go with doing that. Just what you're suggesting. Yeah, I know we have talked about this. You know, the life expectancy for Black and brown people is substantially lower. So, and we see that in the percentages of the makeup of the population at each age range. As we move into 65 and older, those percentages grow a little bit, and they grow again, to your point, as we get younger and younger in the population, until we hit the numbers that everybody's familiar with. My sense of this at this point is that there will be two things that will happen for us. One is that we'll drop our age range, and we will be vaccinating across tier 2 and 3. And as we start to look at some of the labor force that has been in action and working continuously in our grocery stores and our food outreach and our entertainment in our restaurants, as we move into those clusters, we will begin to see more and more Black and brown folks who are younger age have access to the vaccine. So those things will work in our favor. Not saying will not expire. We will be looking at that, but there are some other factors that will help us, I think, as we go forward.
Appreciate that.
I would just add, to what Dr. Crowell mentioned. It's funny we in doing the 60 Minutes interview, we talked for well over an hour, and it's interesting what sound bites get cut down and how it gets edited into a short period of time. But one of the conversation pieces was around equity, and we had a great conversation about it. And one of the questions that Mr. Whitaker asked me was, how do you respond to residents who say it's not fair to promote an equity framework that has allotment of doses to certain races and groups? And my response was, and I think this is important for folks watching at home, this underscores why it's important that we're having this conversation. We are not trying to discriminate or lock anybody out of the system, but fundamental core, to go back to the term of core fundamentals of public health 101, is when you have a situation where you identify risk factors for a particular situation, it is our job to not only use the data to identify those risk factors, which the data clearly supports across the board, here in this jurisdiction, as well as across the state, that Black residents have significantly higher COVID-19 fatality rates compared to other residents, and Latino residents have a higher percentage of cases in comparison to other groups as well as Black residents. That alone underscores that we're seeing, and also the zip codes as well. So we have been able to use epidemiologic surveillance data to confirm that there are certain qualities and characteristics that have predisposed people to having a higher risk of contracting it, as well as having a severe outcome with the disease. As a result, it is our task in public health to then go through and recommend solutions and strategies that provide access to whatever those solutions and strategies are to prioritize to those groups who've been identified at higher risk. So that's why we are using an equity framework. That's why we're doing the work and making the recommendations that we are, is because we have seen such a disproportionate impact on those very same communities throughout the pandemic. And it's important that we utilize and mobilize our resources to address that.
That's exactly right. And I know my time is up. I just say, I think that you just made the case of why it is legal. Not only legal, it's data driven and based of why we should be doing it. And again, if we made that announcement, you'd get a lot more people to register. There's already people calling all of our offices saying, I'm trying to, we've had fatalities of Black workers that are under 65. It makes no sense. And I think we should do it. So I appreciate you looking into it, and I'll be following up. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Thank you. Appreciate the conversation, all the comments that have been made. Just wanted to acknowledge and appreciate all the work that you all are doing, your team is doing. The fact that we're nearing 15% of all of our residents being vaccinated. It's not as much as we would like, but it's progress, and that we're slightly above the state average, I think, is a good reflection of that effort. And I just wanted to note, a few weeks ago, the state in total was receiving 72,000 vaccines a week. Last week it was 88,000 and had been for the past few weeks. With Johnson & Johnson, my understanding is the state's going to have 200,000 approximately vaccines. That's the good news. That's progress. I mean, we are slowly, steadily, certainly not as quickly as we would like, making progress. It's important now to make sure that the county in total, not just the county health department, as you all have acknowledged, is receiving a reasonable and equitable share of those 200,000 vaccines. And I think we all expect that that's going to increase significantly moving forward, and we'll have to continue to push for that. So I just wanted to note that there is some positive news here. I know we've talked a lot about some of the challenges, and there are plenty, but I did just want to note that. I appreciate the fact that there are continued conversations about the mass vaccination site. I think having Germantown campus as an option is a good option. I just wanted to note and reiterate, I do think it's important that the drive-up sites are important, but for those who don't drive, we don't want to replay the issues that are happening for residents having to go to other parts of the state for a mass site, and have a mini version of it, so to speak, in the county. We have a lot of residents that live all over the county, not just in the down county, but all over the county that don't have access to cars, and particularly the most vulnerable, underrepresented communities and our older residents. And so I know you're sensitive to that. I just wanted to note that again, because those two particular sites are not the most accessible for those without access to a car. And so I just wanted to reiterate that there are a number of other sites. I know you're looking at some of those sites. I just wanted to make sure I put a marker down on that and highlighted that, since it's of significant concern to many residents. Just wanted to get a couple updates, if that's okay here. The first is related to teachers and educators. I say teachers, but I really mean educators, those who work in school buildings, since they're all included in that group. Is the number that we still believe in the March 15th, broad, kind of first large scale reopening, although it's a phased reopening and some have already gone back to school this week. Is that number still 9,000, give or take, of educators? And do we have a sense, of the progress of how many of those have been vaccinated, both through Johns Hopkins and, if we yet know, through the broader, system?
My understanding, and this is an update, I have to follow up with this with Hopkins this morning. My understanding is there's somewhere in their area of 65 to 6,700 appointments that have been made. But I will say that in the email from Hopkins, they said that they've actually gone back to MCPS and asked for additional names beyond the 9,000 because appointments are not being filled as fast, which I need to confirm this, but seems to indicate to me that they've sent out offers to everyone on the 9,000 list and need more people to add to the list. And so once I confirmed that, it was while we were in this conversation that I got that update. So I need to follow up, but that actually would be promising news, in the sense that while not everyone's been vaccinated, at least everyone's had an offer made to them. But if I can confirm that, I will. But yes, that is the number, and we're about 2/3 away through that number based on my most recent update. But obviously, the last third is the question: how many of those people are going to want to be vaccinated? Is a question we can't answer. Our goal was to have offered everyone in that first group, 9,000, the opportunity to be vaccinated before March 15th, and I think we are easily going to meet that goal.
That's terrific news that you'll reach that goal, or in partnership with the school system and Johns Hopkins and others, that you'll meet that goal, because I know the health department isn't doing this alone. Certainly, If you could share with us, that would be, significant news to be aware of, whether or not, all have been offered at this point. Is there any indication of whether it's a refusal, or a wait and see approach from some of the educators who are turning down the option, or if it's because they had actually been vaccinated in other sites or a combination of the two? Are we yet able to kind of target that number and only offer to those who haven't been vaccinated yet? Are we scrubbing out the folks who have been vaccinated at other sites?
So this is a hard thing to do when you're occupational based. You can do it for age. So we can take all the data in Immunet and scrub out our list for age-based vaccination. But when you do it by occupation, the state, for example, I think on the state prep mod system, you do list you can check the box for your occupation, but it's largely a educator or school staff or something along those lines. And so you wouldn't be able to discern who's a non-public versus a public school employee. Someone who lives in Montgomery County but works in Frederick County school system would check the same box as the inverse. And so knowing it's not like there's a box that says MCPS.
So it's yet another challenge of not having a centralized system.
Right. And so you end up with
right.
the data, getting that data correct. I know that the school system was preparing a survey, essentially asking their staff. The inverse of that question is, who on this list still is seeking a vaccination? And that way they have to affirm, that way you don't have to ask people
reiterate your request,
Right.
your pre-registration to kind of self-filter who has already been vaccinated elsewhere.
That way they don't have to provide medical information if they're not inclined to. It was a way for the school system to get around the question of the HIPAA implications of doing that.
Got it. Well, that's helpful. If you could share any information you have on that. I know you're looking into any of the additional vaccines that we're receiving. What of those, and Hopkins is receiving also, because they've received a large increase statewide of what of those can be targeted towards educators, which would be great. Can we get a just quick update on how the homebound pilot worked? I know you started that, of how that worked, and what, if any, plans there are to expand that.
So thank you. So we actually did have to do some additional training for the staff. So we did not launch it over the weekend. We launched the other site. We do have also another vendor that we're looking at, who we've been working with through the pandemic as well, who may also be able to offer additional help and support in that area. And I believe today is Tuesday. Yes, we met yesterday. The team met yesterday with them to talk about potential capacity as also an additional option for that. And what I will do is circle back. I know that the team that was going to be a part of the pilot was coming over to get trained yesterday, and I'll circle back with the team to see when they were going to launch. We were going to share 100 doses with them to be able to provide with that. And I'll be happy to provide you with an update once I get that information.
That'd be great. I know I'm out of time. I just wanted to confirm lastly, the 75 plus group, I know the goal was to make sure that all of those who were pre-registered had an opportunity to sign up for an appointment. Has that occurred yet, or do we have a timeline specifically of when that will occur? I know that was imminent.
Yes, so that first wave of emails went out last week, actually, after we first proposed that, and we've been doubling back to ensure, when you talked about scrubbing lists and so forth, trying to match up with the Immunet system to make sure that we sent at least a second email to be like, hi everybody, again, let's remind you, here's your chance to register, because it was important to us as we talk about moving to the next prioritization groups that we had, extended that opportunity. And if there are folks who have pre-registered but they've not received a link, please contact us. Let us know that we can help you work through that to make sure that you get access. And to Dr. Kroll's point from earlier, just because we may move to another prioritization group does not mean that you won't still have the opportunity to get vaccinated. And in fact, as we move forward to those groups, if there are any individuals who are 75 and up, even when we open it up to other age groups and other occupations, we would still work to give prioritization to them to get them in as quickly as we can.
Terrific. Thank you. Appreciate it.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And thank you, Dr. Gales, very, very much for everything that you said today and for everything that you said on 60 Minutes as well. But today you truly reminded us once again of what we need to be doing as a community. And I thank you. Yesterday, I received a call from someone that said, if I was offered the possibility for a Johnson & Johnson vaccine, would I take it, knowing all that's been said? And let me say very clearly, yes, I would take it. I believe that, first off, it wouldn't be approved if it didn't work, and I will take it if I'm offered it. And that same person asked me, and I believe they would take it as well, but they said when the county sends the invitation, or what the right word is, that you can sign up for an appointment, will we say that you have that you would be offered either the 1 dose, the Johnson & Johnson, or the 2 dose? How will that work?
So, Councilmember Katz, thank you for your words of support. And you must have been listening in on one of our conversations before we had this meeting, because we were discussing the parameters in terms of how, and this is unfortunately a limitation of PrepMod, in terms of how we would set registration up. And so one of the challenges, as it was explained to me, because I had a little bit of a block on understanding this, is that you can't, there's a limitation for you. Like if you get a registration link, you can't pref and say, I want the Moderna versus the Johnson & Johnson. And so while we try to get some more information on that to see if that can be fixed, what we're looking to do is say, okay, in the absence of allowing for self-selection, if you will, as best as we can with all of the epi information we have, who would we would recommend the Johnson & Johnson dose for. And so we're looking at how to set up the clinic schedules based upon that. So, because at the end of the day, you're right, all of the vaccines are viable, do provide protection. And, in the absence of ACIP or others coming to say, Johnson & Johnson is contraindicated in this group or should be used for that group, we would, create slots and allow folks to register. And if for some reason, potentially now, if for some reason they say, I don't want that, I potentially want the other one, we'd have to come up with a fix for that. So that's some of the stuff that we've been working on behind the scenes this morning to try to figure out before we roll it out and make it available to folks.
I would only add to that, the one key thing is it's extremely difficult to utilize 2 vaccines in the same clinic at the same time. So it's probably not going to be a situation where you show up and get to switch whatever you're assigned, because there may not be that other variant at that clinic at that time, because it gets very risky mismatching those, particularly in a setting where sometimes you're giving first and second doses already, then you throw in a second vaccine, and that's how mistakes can happen, and we don't want to have that happen.
Thank you. And thank you for this.
The last thing I would just add to that is that aside from the issues of logistics that Earl just raised, that Dr. Stoddard just raised, there's an issue of what doses we have available and how many doses we have available. And we've gotten this initial shot of J&J, pardon the pun, but we're not clear yet how often, how much, et cetera. So the choice, once ACIP, and we've gotten a sense of the guidelines around that, once we'll factor in, of course, but once that's been decided, then the question is, do we have doses enough to offer that kind of choice for folks?
Thank you. And I do, and I appreciate that we need to make certain that we're careful on how we're reopening places, and schools obviously are the #1 priority. I know that you're already talking to the hockey community, or will be talking to the hockey community on what could be done there. But yesterday I met with a couple of people who have outdoor venues, massive restaurants, for a lack of a better word, and they too would like to be remembered to please put them on the list when possible, because in their case, they have to book out events many months in advance if someone's considering a wedding or whatever they're considering. And the closer we go to you know what I'm saying, we need to give them as much time as possible, with the caveat that if things don't work out, you're going to have to cancel, but at least it gives them an opportunity. And their competition in many cases are places in Frederick County, where they are allowed to have larger venues. So if we could please do that. And I'm going to end on this, but the greatest problem we could have right now is if we had so much capacity that people are criticizing us for not getting it in their arm. I believe that would be the greatest problem that we could have, and I believe that we could solve that problem. So that's what we need to be working towards, is solving that problem. Thank you very much, Mr. President.
Thank you, Councilmember. Councilmember Reamer.
Thank you. Boy, I lost my train of thought. I just wanted to comment on the question of how vaccines could be, eligibility could be better targeted according to risk. And race is absolutely one of those factors. And, I know there are countries that have actually set up different criteria according to race. And, this country has chosen a different path through ACIP. And, like Councilmember Jawanda, I have wondered, why couldn't we do it differently? It does seem as though legally there are quite significant barriers there. I think it really merits consideration. The other point I'd make, sort of related, it's not really satisfying that specifically, but again, if this vaccination surge comes through, which I think we have every reason to believe the manufacturers are accurate now, I think in the early stages of the rollout, they didn't know, they weren't able to predict as easily what they were going to be able to do, but I think their systems are now operating. There's going to be 146 million doses coming over the next 4 or 5 weeks out of the manufacturing facilities. We ought to be able to open up eligibility very quickly. We should, and we'll know. Next week we'll know what's coming. But we should be able to open up eligibility very quickly to the adult population with health conditions, which is about 40% of the adult population. And I would anticipate we could get most of the way through that in April. And so, we ought to be able to lower to 65, get those essential workers, and adults with health conditions quickly. And obviously we're all hoping that those doses do indeed leave those manufacturing facilities and arrive here on that time. But, just want to say, if there is a way, if there could be a way, I guess the last question I have, is there any way that the county can consider the second dose, how that is timed within the CDC framework now that there is a surge of doses coming and the longer term predicted supply is significantly increased? Is there any conversation at the state level about taking advantage of this next surge to get first doses more widely administered, and maybe stretch the second dose a week or two, consistent with the CDC, guidance?
I don't believe so at this time.
Okay. Well, I think it's worth discussing. I mean, it's a difficult issue, I know, and I imagine it must be something that the state would have to agree to, or else they could withhold doses that would come to the county.
The state guidelines specifically say that they will not give you another second dose if you use a second dose as a first dose.
Right.
Like they're explicit in that. So you're correct. There is a lot of conversation around this at the national level. I know that Dr. Fauci has pushed back on the notion that we not do second doses for fear of the implications for the partial immunity that you may get and the relationship with variants. But obviously that's certainly a conversation that's happening at the national level where we've not seen much movement. But the state could, I don't know what the state flexibility is relative to what they receive from CDC. So their hands may be tied in the same way, but I don't know the answer to that.
Okay, thanks.
Thank you. All right, I don't see any other requests from my colleagues, so I really want to thank you all on behalf of all of us for a terrific briefing and for all your tireless work to keep our residents as safe as possible. Thank you all so much. Look forward to seeing you again soon this week.
Thank you.